Johanna Ralston with the World Obesity Federation. It is a great pleasure to welcome you to our third in a series of webinars on obesity and COVID-19. Today's session is on children, obesity, and COVID-19, risks and recommendations for the most vulnerable populations. We have an outstanding line of speakers. We will have a new panel session as well, and we're really looking forward to a fantastic hour together. Next slide, please. A few housekeeping issues. First of all, if you look at the bottoms of your screens, you will see both a chat box and a Q&A box. Please do not post questions to the chat box. We're not monitoring it, but please do use the Q&A function. That is where we really strongly welcome your comments and your questions, as we have a lot of very interesting and complex material to cover. There will be a chance to ask questions after each speaker and then as part of the panel session in the middle. The recording slides and certificate of attendance, if you require that, will be circulated post-webinar. And now, next slide please, it's my great pleasure to introduce my colleague and the overall chair, Louise Bauer, who is on the World Obesity Federation board, and also, of course, as pediatrician and childhood obesity leader based in Sydney, Australia. Louise?
Thank you, Johanna, and good morning, good afternoon, and good evening to everybody who are coming from many countries around the world. As you can see from the agenda, we're going to have Grace O'Malley speak, especially around issues to do with the impact of COVID-19 on children, in how obesity may be affected. Anya Yastrobov will then talk about treating children and adolescent obesity during the COVID-19 crisis. We will then have a panel discussion with Joe Jewell, Simone Barquera, and Paula Lashley, and then we'll finish right at the end with a summary and key points. As we've said before, please use the Q&A function to post any questions that you may have, and we'll attempt to have questions after each of the speakers. If we go to the next slide, you can actually see our speakers, and you can read more about their bios elsewhere. If we go to the next slide, we've already had the welcome and introductions, and I'll hand back now to Johanna to give us a little bit of an update on COVID-19.
Thank you, Louise. Just briefly, I think for those of you who joined us 2 weeks ago, at that point, the number of total confirmed cases had just passed 1 million. And so we can see what's happened, and sort of it took 3 months, I think, to get to 1 million, and it has been quite quick to double. And we can see where the highest number of cases are, as well as the total deaths. And thankfully, I think it's important to see also there's recovery that's happening as well. So this is, again, the spread across the globe, and we also know that this is confirmed cases. There's much testing that remains to be done, much testing that's not available in many places. So we expect the places where the numbers are relatively low will continue to increase. If we can go to the next slide, and again, I commend this to you. If you've not seen this, it's the Johns Hopkins page that's tracking this. I'm going to turn this back over to Louise, and then I'll come back in on the next slide. Louise?
Thank you. The previous two webinars have dealt with largely obesity and in adults and COVID-19, and I highly commend those two webinars because it was a wealth of information. But today our focus is on children and adolescents. Now, why is this? Well, I hope you all realise that obesity in this age group is increasingly prevalent. There's a tremendous publication from World Obesity Federation called the Atlas of Childhood Obesity, which was published last year. And there are predictions of obesity globally in 5 to 19-year-olds. And you can see in 2020, 158 million. And by 2030, the estimates are that it will be 254 million, dramatic increase. By 2030, the countries that are going to be particularly affected are China, India, USA, Indonesia, Brazil, Egypt, Mexico, and so on. So many low and middle income countries. And of course, there are many small island nations which have very high prevalence rates in the Pacific and the Caribbean and so on. So we need to recognise that. In addition, for children and young people, the COVID-19 pandemic potentially makes obesity prevention more challenging, and we'll hear more about this. It affects access to and availability of treatment for obesity, and it especially affects the disadvantaged people, including those from low and middle income countries. So that's our focus today. And I want to remind you that children and young people are vulnerable in all cultures, and they are our future. It's really important that we focus upon them. Over to you, Johanna.
Next slide, please. So just quickly, I wanted to also frame this in terms of what we're seeing and even evidence that's coming to light in the past 2 weeks since we started this series. While obesity has not been sort of confirmed as a risk factor for COVID-19, it certainly is clear it's a risk factor for complications of COVID-19. And we do believe, particularly if patterns that we've seen with influenza are followed, that obesity itself would become an independent risk factor for COVID-19. That quote is from a piece written in Obesity, the Obesity Society's journal about this. Again, we're seeing the New York Times yesterday covered what was seen at an NYU study around obesity being linked to severe coronavirus disease, and particularly again, and that's why this is relevant to today's session, for younger people. Now, we work closely with the World Health Organization, and we are proud partners to them, and they are really starting to, they've issued a statement around non-communicable diseases and COVID. Obesity is not one of the 5 by 5 in the NCDs, 5 diseases or 5 risk factors, hence we may not see it prioritized and explicitly referenced as much as one would hope. But we do work closely with our partners at WHO around ensuring that obesity, the sort of approach to COVID-19 includes addressing this phenomenon that we are seeing of obesity, specifically being tied to sort of severe obesity being associated with greater ICU and greater likelihood of obesity and at younger ages. If we could just click the animation. I want to also just show this was something that came from WHO. This is a word cloud that they developed in response to ministers of health, countries, the UN, coming to them and sort of saying, these are the things, these are the issues that are coming up for us around COVID-19. So whether or not obesity is specifically in global policies, what we definitely see that it's being demanded at the country level, at the member state level. You do see the word obesity figured several times in this word cloud. And so it's very clear that countries are facing this issue, and many of those countries are actually on the call today. Next slide. Back to Louise.
We now come to the first of our speakers. Grace O'Malley is a clinician scientist working at the Royal College of Surgeons in Ireland, in Dublin. She leads a multidisciplinary clinical service for children and adolescent weight management in Children's Health Ireland at Temple Street, Dublin in Ireland. She's also the Secretary of the European Association for the Study of Obesity. I hand over to you, Grace. Thank you.
Thank you very much, Louise, and thank you, Johanna. And thank you everyone for being here. This is a very important topic. Mike, at the next slide, please. So as COVID-19 develops globally and infections with SARS-CoV-2 virus become apparent, we have building data in relation to adults and children. And so far, mostly from data from China and the US, we see that children infected with SARS-CoV-2 are less likely to develop the symptoms of fever, cough, or shortness of breath. So they tend to be more asymptomatic. Of positive confirmed cases in China, 1 to 5% of those were in the child and adolescent age group. And there was a low mortality rate reported of 0.18% so far. Around 5.7 to 5.9% of children have been hospitalized. This is based on a study of over 2,000 cases in China. Now, in that study, about 34% of those were actually confirmed cases. So there were other suspected cases involved in that study. Children under 1, so infants, are more likely to develop severe or critical illness, and also children with underlying conditions. And the data is quite sparse so far, but from the underlying conditions that we know to date, conditions such as intussusception, leukemia, or children with immunosuppression or kidney disease have been reported to develop critical illness. In another study of 8 critically ill children with COVID-19, 3 had underlying conditions, but 5 didn't, and they recovered quite well. And obviously this data is evolving and being published daily. We've heard from the previous 2 webinars and from the data that's been published that adults with obesity are at greater risk of complications of COVID-19, and also from previous flu, H1N flu. But we really don't have the data currently regarding children with obesity. So although we can learn from adults, as of yet, we don't have strong data. But we do know that of those children who are affected, they can be affected severely, and they'll obviously require assistance and medical help. Next slide, please. But more importantly is the larger societal effect on children due to how our societies are responding to this pandemic. So currently we have around 1.38 billion children who are out of school or out of childcare. And this can have significant effects on issues like food security or dietary quality. So for children who rely, previous slide. So for children who rely on school for a regular meal, or indeed for a quality meal, those children may be at risk of nutrition, their nutrition requirements being met. The nutrition in the home may be different now. Also, with parents either under financial stress or out of work, there's increased parental stress. And from other previous pandemics and emergencies, we know, unfortunately, that children who are in quarantine are more likely and at an increased risk of violence. So child protection and child welfare is something that really should be in the forefront of all of our minds. There's also some data around children under quarantine developing post-traumatic stress disorder. So these psychological effects will be something potentially that we will see. With children being sheltered or remaining at home under quarantine, we see increased sedentary time. So as we know, children do not exercise like adults. They move much more spontaneously in short bursts, and they like to play. Now at home, they're maybe in smaller spaces. They're using potentially more screens, so spending more time on screens, be it for school or indeed for entertainment, and there's less opportunity for that spontaneous play and activity. For those children who are already overweight, we know from US data that during school closures, so during summer holidays when schools are closed, the general population of children gains weight, but those with overweight tend to progress in terms of their obesity. And when they come back after summer holidays, that doesn't reduce again. So we can anticipate that the general population may increase in weight, but also that those who are overweight or obese already, that their condition will progress. And with that increasing obesity, we could expect progression of complications. So the complications that we often see in obesity include musculoskeletal pain, reduced aerobic capacity, respiratory difficulties, endocrine difficulties, gastrointestinal impairments, and psychological issues like potentially low self-esteem, depression, or anxiety. So for those children already with obesity, we could expect some degree of progression of those complications, depending on how long this pandemic lasts and the societal response to that. And the next slide, please. There's also considerations around our societal efforts for promoting child health and interventions that we know are effective in preventing obesity. So for those ladies now who will conceive in the next few months, the weight that they may gain now when they're out of their normal routine could affect their pre-pregnancy weight, which can, we know, affect further down the line the offspring birth weight and growth trajectory. Also access to antenatal health and antenatal classes, depending on where you are in the world, whether there's access to telehealth. Many women will now be pregnant and not able to access their usual antenatal care. And this in fact can affect potentially gestational weight gain. And we know gestational weight gain is a driver of childhood and infant obesity. So for ladies who are pregnant at present, there's a likelihood that their weight gain will be increased while they are pregnant. For those ladies who are hoping to breastfeed, the supports that are normally needed and often for particularly new mothers, be that their sister, their friend, their mother, their grandmother, they may not have that access to that network now for breastfeeding. And in turn, they may not have access to group breastfeeding classes or peer-led classes or classes and groups held by the health services to support breastfeeding. So on one hand, we may find that some women who would breastfeed or would breastfeed for a minimum of 6 months may not be able to do that now. On the other hand, we may see that women who would be returning to work before 6 months, or ladies, depending on where they are in the world, going out to work at 6 weeks, 12 weeks, 3 months, now, if they're remote working or if they're at home, there may actually be a better opportunity to breastfeed or breastfeed for longer. We know that tobacco exposure is also a driver of childhood obesity, and for children who are now not in school, there may be more exposure to tobacco in homes where there are smokers. So that's of concern. For these children who are at home, and as you mentioned, screen time, there's some good data that's been published around the use of online gaming, and that's really, really increased in the last month or two. So children are online more, and with that comes a risk of exposure to advertising. So we know from data that advertising of high energy dense, nutrient poor products can affect purchasing and consumption of these products, which can in turn affect weight. So there's a risk that children now are being exposed to far more advertising than previously. In relation to being outside and playing and having access to areas to be physically active, this will be very different depending on where you are in the world. And we definitely know that there's inequality effects regarding that. So in Ireland, for example, we have a 2 kilometre limit on being able to exercise within that 2 kilometre range. But depending on whether you're in an affluent area or a disadvantaged area, you may not have access to an inviting park or space where you'd like to be outside. And in areas where there are highly dense apartment blocks, we've heard from patients that they just don't want to go into those public areas to play because of the amount of people hoping to use them. With this pandemic and being sheltered and being indoors more and the stress of this on families, we do see that routines are being altered, and this can have an effect on sleep duration, but also sleep quality. And we know that sleep is really, really essential for weight regulation, particularly appetite. Children who do have access to the internet or to hardware equipment may be able to receive schooling online. Whether or not they're receiving online physical education classes, we do not know. Many schools are not able to provide this. And then there will be children who will not be able to receive their schooling online due to not having access. Clinical support, I know we're going to discuss over the next hour, and this obviously as well depends on your access to technology. But with these challenges and risks, we've also heard from patients that there have been really good opportunities like developing a closer family unit. So for families who now have more time together, where parents maybe are in the home more, and where activity and play, although in Ireland, so we're able to get out to exercise once a day, maybe for families who previously didn't play together outside, now there's a real value in that, of being outside together, playing football, going for a walk. So we have heard from families anecdotally that some of those bonds are really strengthening, and also that there's new skill development. So for families who may have gone to restaurants a lot or used takeaways, some of the adolescents and parents are really reporting that they're developing cooking skills. They're learning how to do things because of need. And I think that there's a real opportunity after this pandemic to develop further skills and support families to manage their obesity within their family, but also to promote health in general. Thank you.
Thank you, Grace. folk, we'll need to move on a little bit more. I'm hoping that after our next speaker, we might be able to have a chance to answer some orally some of the questions that have been raised. We'll just see. So Grace, may I encourage you just to have a look through some of those Q&As in case you can respond to any of them. But in the meantime, I'll move on to Anya. Anya Yastrobov is an adult and pediatric endocrinologist and obesity medicine physician at Yale University School of Medicine. She has clinical expertise in sophisticated use of anti-obesity medications for weight management. We're delighted to have her speak about treating children and adolescent obesity during the COVID-19 crisis. Thank you, Anya.
Great, thank you so much for the introduction, and thank you for the invitation to speak today on treating childhood and adolescent obesity during the COVID crisis. I care for adults and adolescent patients, and today I will focus on the care of adolescents with obesity. Specifically, I will focus on telehealth clinical applications during the COVID crisis, if you can, thank you, perfect. So telehealth is the use of digital technologies to deliver medical care, health education, and public health services. For the purposes of this talk, I'll mainly be referring to video conferencing for real-time patient-provider communication, but much of this can be done by telephone, and certainly we do use that a lot as well. So there are both positive and negative aspects to telehealth. So I'll start with the positives. So of course, telehealth supports social distancing and helps to keep our patients and everyone safe during this time. It's interesting, for some of our clinics, the show rates have actually improved, and there is some preference in terms of younger patients, younger meaning adolescents and teenagers, who actually prefer this mode of communication, and they really have liked the telehealth and telephone visits. They're used to doing that with their friends and family, and now they can do that with their providers. In terms of family focus, so a positive aspect of this is that now the child or adolescent and the parent caregiver is in the visit, but also potentially other caregivers in the home, such as grandparents or individuals who could not come to clinic with the child or adolescent are now also available and can meet the care team, and we can meet them. Telehealth also potentially enables us to see the home environment. So you can invite your patients and ask them if they can share with you what's in their cupboard. And it really gives you a real view of what they have available, what their resources are, and can better inform how you advise them and how you help them through this crisis. So there are negative aspects to telehealth, of course, the main one being access and availability. If you don't have a smartphone or a computer, this makes it not possible to have video conferencing unless you can find one somewhere else. Even if you have these technologies, there's always hurdles. There's internet problems. So even if you have these mechanisms of communication, sometimes you're not able to use them during the time of the visit. In terms of the exam, so I put here only visual exam, but of course there's so much that can be learned from a visual physical exam. And in terms of vital signs, there are some vital signs that we can do with patients at home, for example, taking a pulse or a temperature if they do have a thermometer, so there are those options. There's of course noise and distractions in the home environment, and sometimes those cannot be eliminated. Now, if any of these are occurring or there's no access or availability, of course, the visit can be converted to a telephone visit. And we do that quite often, even in the middle of a telehealth visit with internet issues. Next slide, please. So now I'll just briefly talk about the patient visits themselves. And as I mentioned in the previous slide, family-based treatment is critical. So of course, in these visits, just like you would in person, the parent or caregiver has to be present with the child or adolescent. In terms of assessing the current needs, the first thing that I do and I recommend is to ask, listen, and hear. So the patient and family will tell you what they need in this new context of social distancing. So ask them and listen. You want to know what their issues are and how you can potentially help them. So in terms of return and new patients, slightly different approach. So for return patients, I encourage continuity of treatment, and I emphasize that they might actually need extra support during this time, whether it's from their provider, from the dietitian, from other members of the team, psychological support. I also continue ongoing anti-obesity pharmacotherapy within safety reasons, of course. So, you know, if they need to have monitored vital signs or something like that, then we discuss that. But I do continue ongoing anti-obesity pharmacotherapy. For new patients, it is an opportunity to evaluate, to get to know them, for them to get to know you, and to initiate the discussion of long-term care and treatment, and to begin lifestyle and behavior change. Next slide, please. So I'll finish up by saying that what I basically do during these telehealth visits, and that's really focusing on incorporating structure and daily routines as is possible. This is really a way to think about maximizing the opportunities for behavior change during social distancing, which Grace mentioned. So structure and daily routines are very helpful for children and adolescents, as they are for adults, but especially for these younger age groups. These types of routines and structure can actually help decrease anxiety and bring a sense of normalcy back to their day during this very confusing time. So what I address with them during telehealth visits are things such as eating. So trying to see if they're able to have planned meal times, discussing the advantages of meal prep at home. So a lot of the patients that we see may be eating out of the home or eating some fast food. And this is really an opportunity to know what's in your food and to learn about that. Helping them to identify healthy snacks is also important. So physical activity is critical. I discuss, trying to build this into their daily routines, whether it's walks or going outside, if they're able to do that and have the resources. Even things such as dance-along videos and other types of family activities that they can do together, whether it's hiking or something that they can do that's physical. And this helps decrease stress and anxiety, as well as keeps our children and adolescents moving. So in terms of stress reduction, I just mentioned physical activity. There's also hobbies, projects, art projects they can do. And I very much encourage them to continue seeing their mental health professional virtually if they're able to do so. In terms of education, of course, in terms of virtual school, those efforts are ongoing, and I encourage at that point to also include topics such as healthy food choices, nutrition, learning to cook with your family, really some great opportunities there potentially, and virtual visits with the dietitian if possible. And then finally, sleep is critical. And during this time where there's no school and no sports activities and other things that our children usually do, really implementing a structured wake time and bedtime is critical. I really encourage no screen time before bed and really instituting bedtime routines. And all of this, really, the question is, after social distancing, what will occur? And the goal is to continue these healthy routines and try and use them going forward. Just like hopefully these routines will be used, so will telehealth hopefully be used. And so I'll just conclude with my last slide, if you can move to the last slide. Which is that social distancing is bringing us closer together, whether it's telehealth or helping our families institute some of these routines if they can. Hopefully there's a silver lining to all of this and we'll come out better at the end of it together. Thank you so much for your attention.
Thank you so much, Anya. I'm going to ask you a few bullet point questions related to some of the work, and Grace, be prepared. Some of them might be relevant for you. There were questions around what time does it take to do a teleconsultation? What's an optimal time? And could you comment also on about whether you use telehealth for old or new patients, or what the issues are for that?
Sure. Those are great questions. So in terms of time, what we're allotted is the same, at least at my institution in the US, is the same that we are allotted for regular in-person visits. So it's 40 minutes for a new patient and 20 minutes for a return patient. And I think that would vary based on your institution. I would say that the phone call visits go very quickly, and patients often stay very much on task, whereas the telehealth visits sometimes run a little bit over just because of some technical difficulties. But, you know, for the most part, it's been working well. In terms of old and new patients, I encourage telehealth if possible for all patients, but especially for new. I have done a few new patients via telephone, and it's a little bit challenging. There's so much to be gained from visually seeing each other, from actually having those visual cues and body language. So I do, especially for new patients, encourage telehealth, but for all patients.
Thank you. We will just actually acknowledge, of course, that in some jurisdictions and places, telehealth may be almost impossible due
Absolutely.
to internet access, all sorts of other issues as well.
Absolutely.
Grace, I don't know if you're able to come on. Could you talk about, Grace, managing screen time during lockdown periods? How on earth can you achieve ideal screen time behaviour when people are locked in flats or houses?
Yeah, I think it's really very challenging, because not only will children be trying to use their screens, but perhaps adults who are working at home are also trying to use screens. But like you would normally do, so trying to have a routine. So maybe that's not having the screen on during mealtime, having particular programs that the children usually watch on television, or if it's phones, that there's particular times in the day. And particularly trying not to use social media updates around COVID-19. So for adults, but also adolescents, and maybe some children who are, you know, following some threads or channels that are dealing with COVID-19. We can expect increased stress, receiving notifications and updates continually around these. So I think having a regular routine, understanding though that this is a very abnormal situation. So having very strict rules, obviously each family will know what works for them, but trying to have a routine and following, you know, the general guidelines of having screen time turned off an hour before bedtime. I think that's very important, because that time before sleep is really important now for wind down and to try and promote a healthy sleep. It is a challenge, but trying to stick to a routine, I think, is really important, and having some type of rules or guidelines within the home.
Thank you, Grace. Folk, we've got so many questions to go through, and we will attempt to try to answer some of these later on. Just before I move to the next group of panelists, I will just make some general comments. There was a question around guidelines for preventing obesity and treating obesity in adolescents. There are very good many national level guidelines on prevention and treatment of obesity in both children and adolescents in many countries, and good narrative reviews and good detailed reviews in high quality journals, and we can reference some of those as well. A lot of the core management relates to good messaging around healthy family lifestyle, around food, physical activity and sleep, and they would normally follow, be based upon national guidelines around food, physical activity and sleep. So I'll just highlight those issues, because that's what we're reinforcing as the absolute core, but of course there's additional therapies that are needed. I want to now move on to our panellists. We've got a tremendous group of people here, and I want to first start. Each one of them has a slide. They're going to talk briefly, and then we'll have a panel discussion. Our very first speaker is Jo Jewell, who is a nutrition specialist in childhood overweight Prevention at UNICEF with a background in public health policy. Thank you, Joe.
Thank you very much. Is the video working? Can you confirm that people can see the video and my slide as well? Yeah, okay, great.
Yes.
So I'm just going to use my time really, which is quite short, so we have enough time for discussion, to focus a little bit on the prevention dimensions. I think Grace and Anya also did a great job of bringing in the prevention. But I want to also focus from the lower middle income country perspective. I think this, as this is going to be a protracted pandemic, and it's also affecting many countries where overweight and obesity is a major form of malnutrition, if not the major form of malnutrition. This is a really important conversation we're having, and especially in our nutrition response to COVID-19, we need to be thinking about how to mitigate the risks for overweight and obesity prevention. So in the left-hand panel of my slide, you can see sort of three top-level priorities. One is around ensuring evidence-based guidance and counselling to promote infant and young child feeding, so maintaining optimal feeding during the crisis, promoting access to nutritious foods for children and women, including through the continuity of safety net programs, including school feeding, and finally, ensuring facility and primarily community-based programs for the early detection and treatment of wasted children. Obviously, the final one is less relevant for the audience today, but the first two are very relevant, and these are the priorities for UNICEF in our nutrition response to COVID. And I want to just talk about, what that actually means in terms of the guidance we're providing to countries. We're expecting, as UNICEF, over time, that the impact of COVID-19, there will be a significant undermining potentially of current efforts to promote optimal breastfeeding and complementary feeding, which we know is a critical window to prevent overweight and obesity. If you get the breastfeeding and you get the first foods right, you're on a good trajectory to a healthy diet and healthy weight gain. But we're also expecting it to have a significant negative impact, particularly over time, on the access to nutritious foods. And I think there's a lot of conversation going on around the health system response, which is of course important at this time. But as we continue down these conditions of pandemic and the disruption to the normal functioning of the world, we're going to see this become a food system crisis as well, potentially. We're going to see, and this is on the right-hand side of my slide, is an illustration from UNICEF around how food systems have an impact on the diet of children and adolescents. And if you look at this sort of diagram from the perspective of COVID, you can see how each of the elements of the diagram are potentially going to be affected negatively. So, for example, as we see the crisis continue, it's very likely that the food supply chains will get disrupted due to, for example, shortage of input into the supply chain, or even shortages of labor as people are unable to sort of work in the field, work in retail. That will then directly impact the external food environment, because the availability of nutritious foods, such as perishable fruit and vegetables, will become more limited. We may see price hikes for certain foods, as the supply and demand balance is altered. We may see fruit and vegetables becoming more expensive, for example. And also then in terms of people's personal food environments, because of the conditions of the lockdown, people may be not able to move around so much. There may be loss of income, due to job losses. But also the fact that they are at home with family may mean that they're not able to get out so much to buy food. And also the policies that governments are implementing in terms of retail or markets shutting down will have an impact on access to nutritious foods as well. And so finally, I think also we need to think about how the behaviors of families and children may change as well in response to COVID-19. Again, people are juggling multiple tasks at home. They're going to be struggling to sort of prepare nutritious foods. They may not have the skill, and there also may be a preference to shift to the unhealthy foods because of long shelf life or even familiarity, comfort, etc. So we may see negative consequences due to this impact on the food system. I think the other speakers are going to actually speak a lot more around sort of specific responses, and hopefully in the discussion it will come out. But I think, we do need to be thinking about ensuring that local markets and retail stay open so that people have access to nutritious foods, and thinking about how we can ensure that those nutritious foods are priced reasonably and promoted. Thinking about the online retail, how can that be leveraged? Because, it's not just a high income thing. Online retail is expanding rapidly across the world, and how can that be leveraged to promote healthy foods? Guaranteeing the continuity of school feeding programs is essential, and how can we use alternative delivery mechanisms? Thinking about the social protection system as well, these social safety nets, how can we make sure that they are nutritionally sensitive, promoting nutritious foods, or ensuring that people just have the basic income that they can actually use on food. And finally, how do we adapt our nutrition education and messaging to put emphasis on prevention, promotion of healthy practices from early life through to adolescence? And I'll stop there.
Thanks so much, Joe. You've actually already, in your responses, answering some of the questions that we've already had. I'll hand over now to Simon Vaquera. Simon is a medical graduate with a doctorate in nutrition from Tufts University. He is director of the Nutrition and Health Research Center at the National Institute of Public Health in Mexico, and is a leader in the area of obesity, diabetes, and cardiovascular risk. Thank you, Simon.
Thank you, Luis. Good afternoon, good evening. Sorry. Thank you, Luis. Good afternoon and good evening to everyone. And I am going to give a perspective on Mexico, that is a low or middle income country. And as you know, the epidemiology in our country is dominated by the non-communicable chronic disease epidemic. We are a country in which 70% of all adults have obesity or overweight, and 1/3 of the children. And 300,000 people is dying from obesity-related diseases every year. So we are experiencing a very important epidemic, and doing some efforts to try to control this. We know from many studies that one of the major drivers of this epidemic are the poor quality diets. During the last 3 decades, the diet in Mexico shifted very quickly from traditional foods to ultra-processed foods, and we consume a lot of sugar-sweetened beverage, and more than 60 liters per capita per day, and also a lot of industrialized food. So this is something that is of great concern, and 20% of our diet is from non-essential foods, and about 15% of all calories in Mexico come from sugary beverages. We know that this is and has an interaction with COVID, with a syndemic effect, because in one hand, all these non-communicable chronic diseases create a state of suboptimal immune response, chronic low-intensity inflammation that we have also measured in our country. And in the other hand, we know that as the previous speakers have mentioned, that the condition of physical isolation, physical containment is affecting the normal lifestyle. So we have this syndemic effect between obesity and the COVID-19 infection. And we have not enough resources as a country to adequately resolve the prevention and control of this condition. Only 2% of the budget allocated to public health are in the obesity prevention and control allocated to that. So this is also a big problem. So policies to improve the food environment are crucial. Also to communicate that right now, one of the advantages in Mexico is that the Ministry of Health has been able to centralize all the information that needs to be communicated. So For example, in the case of the National Institute of Public Health, in which I work, we have been able to develop some recommendations on physical activity for all age in this stage of physical containment. Also, recommendations for breastfeeding in COVID, and also some about healthy diets. But in the longer term, we also think the best chance for developing countries to contribute to reduce the epidemic of non-communicable chronic disease is trying to modify the food environment. And this will have positive effects also for undernutrition, which, as you know, in developing countries still is a big problem too, and something that also interacts with the COVID-19 and other infections that are still a problem in this country. So, as you know, there are some regulatory measures such as the front of pack warning labels, the soda and junk food tax, regulation of marketing directed to children, enforcement of the Codex guidelines to promote breastfeeding, policies to incentive physical activity and active transportation. And very important, we need to develop mechanisms to prevent industry interference in the development of these policies. Also, as you know, in many of the Latin American countries, we have implemented strong efforts to implement these policies, but the interference of industry makes them very difficult to achieve. So the collaboration with international organizations and with academia is very important in this sense. And there are some promising results from these policy options in Latin America. With the soda and junk food tax policy in Mexico, we were able to reduce the first year about 69,000 tons of sugar in the consumption and about 7 liters of sugary beverages from the 68 liters per capita that are consumed. And also in front of pack warning labels, Chile has wonderful results in terms of how consumption of unhealthy foods have improved. So this is something that we need to consider very much if we want to prevent more and have less challenge with this kind of epidemics that are right now happening. So just to close, by now, I will say that treating obesity seriously requires, in one hand, reinforcing all the healthcare with training for health professionals and also improve all the communication, but we definitely need to implement policy to improve the food environment as a complement that will allow us to do a better response. Thank you.
Thank you so much, Simone. We're running very, very tight to time, and so we might go straight on now to Paula. Paula Lashley is a consultant pediatrician at Queen Elizabeth Hospital in Barbados and is a Deputy Dean of the Clinical Sciences and lecturer in Child Health at the University of the West Indies, based in Barbados. And she's going to come particularly with a focus around the Caribbean. I just remind all speakers that we're trying to keep really to time, so we have a bit of time for Q&A. Thank you, Paula.
Hi, good morning. Thank you very much for allowing me to speak on behalf of the Caribbean. For those who don't know where the Caribbean is and what we're talking about, the Caribbean includes several islands stretching from Jamaica in the north to Trinidad and Tobago, which are just 100 miles from the south coast, from the South American coast of Venezuela. Before the COVID-19 pandemic, we already had very high levels among all of our children of obesity. And this was triggered by the significant obesogenic environment and the lagging health policy support, which is similar to what we heard in our last speaker from Latin America and Mexico. Before all of this, the Healthy Caribbean Coalition, which you'll see as HCC, had been instrumental at the highest level to promote policy implementation. This group is the only Caribbean NCD alliance of over 100 healthcare civil service organizations, which is really aims to reduce the morbidity and mortality of NCDs and had high on the agenda the fight against pediatric obesity. To date, we've had several successes in that fight. We introduced the sugar tax or the soda tax in a couple countries. There have been increased public advertising about the use of sugar and trying to prevent children from drinking too many sugar-sweetened beverages. There have been several physical education initiatives in schools, and we were just about preparing for front of package labeling. However, the COVID-19 epidemic came upon us. And all of these gains that we made in the fight against childhood obesity are being increasingly threatened here in the Caribbean. These factors included the increased poverty associated with financial instability, and our loss of jobs have been mainly from our vital tourism economy. And the tourism economy has certainly been the most vulnerable sector affected in the job losses in the Caribbean, which is unique to our population. The measures in place for COVID-19, mainly because of the lockdown and other issues, have created environments that are conducive to significant dietary shifts, as we've heard in several of our other speakers. But food insecurity has been particularly important for us because many of our children depended on school meals and breakfast programs, and these obviously are halted when children are not in school. There was also decreased opportunity for physical exercise, as many children are not allowed outside the confines of their home space. And this for us in the Caribbean often means a very, very small yard or just a little area in front of their house. So even though they may have an open space in front of them, it has been said several times through the healthcare authorities and through the government that they really should not even be on the road. And this has really been a big shift for physical exercise, which was fairly minimum for some of them to even start with. We cannot understate, however, that the mental health issues and anxiety among the parents and children themselves. We have many parents who've been mandated to work from home. And as we heard before too, this working from home means the parents are on their screens, and they often encourage an overuse of screens by their children, which triggers overeating. We have also started embarking in many of the countries school from home, so that the aspect of going on their screens or tablets has then become the norm. But what of our successes? With some of our good intentions, our messages are thwarted. There are variable internet access and Wi-Fi, and this creates challenges to disseminate. However, on a major positive note, the Healthy Caribbean Coalition and the Organization of Eastern Caribbean States have made great strides. And together they have published a joint statement this April on strengthening food and nutrition security in the Caribbean. And this is by leveraging our specific strengths, and this has been given priority at the highest national level. You can go ahead and look on the Healthy Caribbean Coalition site and read that joint statement. And I think I'll end here because we are just as much at risk in the Caribbean as anywhere else, and probably even more so because of our vulnerability related to our financial discomfort. So without much ado, I will go ahead and let our panelists be open for questions, and I will stop here. And thank you very much for allowing us to speak on behalf of the Caribbean.
Thank you very much, Paula. Simon and Joe and Paula, we might only have 2 or 3 minutes for questions. Can I just ask if any of you there were questions about having fresh fruit and vegetable availability, high quality food availability during this period of physical isolation and decreased, normal economic operations. Could you briefly comment on what that means in different countries? And my second question to each of you, so you each get to answer that. And the second thing is, what is the one thing you would ask of food retailers during this period of time? Thank you. Maybe Joe first. Joe, we can't quite hear you. We'll see you.
I'm mute. Can you see me?
Okay.
Okay,
yes.
there you go. Okay, now I need to catch up time. No, just to say that those are two really important questions, and I think they're actually, linked, because, the retailers will be one of the most important ways that we can try to ensure that people have access to fruit and vegetables. I think during this period of pandemic, one of the greatest risks is that those foods that we want to encourage as part of a healthy diet, the nutritious foods, fruit and vegetables, and others, are going to be the things that are at most risk of being cut out of the diet for various reasons. I think we need to think, as I mentioned, what is the social protection for our most vulnerable communities? How can we make sure that that is either promoting the availability of healthy foods, or making sure that people have adequate finance to buy those healthy foods? Retailers, but not only sort of supermarkets here, there are many other different types of retailers that we need to think about securing access to, especially in low middle income countries. Markets are an important place. So how do we make sure that retail venues can stay open safely, both for consumers, but also the people who are working there? I think WHO has put out some good guidance on food retail during COVID-19 to make sure that it's done to ensure access to nutritious food, but safely. I think one of the key asks of retailers is to promote food, healthy food, and make sure that it's sold at reasonable prices to people. So don't take advantage of price hikes to put up prices for vulnerable communities. I'll pause there.
Thank you, Joe. Simon, as a short response there, what could you actually comment yourself
yes,
on?
I think to support local markets is very important. In Mexico, healthy food is not expensive, so the ultra-processed food marketing is very aggressive. So the other thing I will ask to the retailers is to avoid unfair marketing of ultra-processed and unhealthy foods, which is they are taking a lot of advantage of the epidemic to promote juices and sugar drinks and other ultra-processed foods, and are confusing the people and reinforce the education of people on what are the healthy options that they can take.
Thank you, Simon. And Paula, would you like to make a comment around issues, particularly with a small island nation context?
Yes, thank you very much. The questions were definitely pertinent. We do have some issues that are different from one island to the other, depending on which islands produce good fruit and vegetables. Some of us are very dependent on imported products more than others, but I think the answer really has to be at the government level. In Barbados, our Prime Minister has been very instrumental in allowing the small market vendors back open and with social distancing, allowing people to come to get their vegetables and fruit. And I think this has made a great impact. In this last week, we are seeing more of our vendors back out with fruit and vegetables, whereas the week prior to that, people only had the opportunity to get into supermarkets. And I think if all the governments did hold that policy that the smaller markets and fruit and vegetables and local crops could be put available for persons, I think we will get a better impact in the societies, because children only got a lot of their processed foods through the school vendors. And if those are not available, then they certainly will have to be given what they're given at home. So I think the government have a big role to play in that. And I certainly think the OECS is on top of that at the moment.
Thank you very much, Paula. We'll now return away from the panelists and go back to the main slide deck, and we might go on to the next slide as we start to finish. Thank you. I just want to highlight, clearly children and young people must be prioritised. I know I'm a paediatrician, I'm hardwired to think that, but I think we all recognise why. And the COVID-19 epidemic especially affects the disadvantaged, and particularly those from low and middle income countries. And I think over the next few weeks, we'll particularly see additional low and middle income countries particularly affected by this pandemic. We know that there's a risk of weight gain across the life course during, because of the constraints from the COVID-19 pandemic. We know that COVID-19 pandemic makes obesity prevention more challenging. Isolation, closure of schools, childcare in many places, food insecurity, poor diet, exposure to food marketing, sedentarism, family stress. And we know that obesity treatment is more challenging. We want to continue healthy routines. There are opportunities with telehealth, but it actually does stop some of the face-to-face and individual clinical consultations that have a lot of other benefits. There are also access issues to some of these issues in many countries, in many parts of some countries. So I think we have to realise that there are challenges, but these are the sorts of key points that we've covered here. I want to highlight that this is not just a high-income country issue. This is a major issue, particularly a major issue for low and middle income countries. Now, I know there's been a lot of questions that have been there. We've only answered some of them. We will, over the next few days, put our answers on these and make those available on the website for World Obesity Federation. I will hand over now to Johanna, who will have some concluding remarks. I want to highlight that we've had a large number of people listening in. More people will listen later on. We want to make this useful for you. Thank you. Over back to Johanna.
Thank you so much to everybody. Thank you, Louise, and to the fantastic speakers. This was really interesting and I think covered a very broad landscape. If we could go to the final slide, Claudia. These are just some of the next steps. So immediately following this webinar, our colleagues at the European Association for the Study of Obesity and the Coalition for Patient Organizations are hosting a webinar on patient issues. I think if you go to the EASO website, which is listed here, you will find details about that. We had a session last week on patient issues, and that continues to be fundamental to all of our work. We will be continuing with webinars, but not on a weekly basis. So we'll be announcing that shortly, and particularly as evidence about obesity accumulates in real time, we will definitely be sort of publicizing that through webinars and convening experts like today's session. I want to really thank the group for excellent presentations and our colleagues from the Obesity Society, the Irish Society Healthy Caribbean, the Mexican Society for Public Health, and as I mentioned, EASO as well. Some next steps as well, further resources are listed here. We will plan to certainly cover COVID issues very much at the upcoming week. We trust and hope that all will be fine for the meeting in early September, the European and International Congress on Obesity. And we also have Scope e-learning modules on childhood obesity, which we strongly recommend that you come to our website to learn more about. And again, I want to thank all of our partners and colleagues and watch this space for further webinars. And as I said, this webinar is going to be available very quickly, I think by Monday at the latest, online and on YouTube. And then the answers to all of your excellent questions will be responded to and available within a week. So thank you again to everyone, and we look forward to reconvening here shortly. Thank you.